Good afternoon, Dr. Laposata.
6 minutes till the afternoon. Good afternoon.
That's okay. You wrote a report in this case, doctor?
Yes, I did.
Do you think that based on your analysis, was Mr. O'Keefe thrust backwards? Is that what you determined looking at his head injury?
That he was, I didn't understand, you had your hand in front of your mouth.
Sure, I'm sorry.
Yeah.
You talked about a head injury that Mr. O'Keefe had, that
Yes.
he suffered from,
Yes,
that caused his death.
yes.
Was that caused by being thrust backwards?
Yeah, the motion was upwards, down.
Okay. And the way you just showed it could be a fall.
Correct.
Did you have an opinion looking at his wound that he was thrust backwards?
What do you mean thrust? His body went backwards. There may have been some applied force to it.
I don't know about thrust. I'm asking if you have an opinion. Your words. Do you have an opinion about thrust?
What do you mean thrust?
Did the forensic pathology diagnosis mean Mr. O'Keefe's body was thrust backward?
If you want to say thrust as indicating movement, that it went backwards, then you could say it was thrust.
Okay, may I approach?
Yes.
I'm showing you page 2 of your report, Dr. Laposata.
Yes.
I'm just going to ask you to read it, not out loud, and then I can ask you the question after we take it. But I want to
Yes.
take a look.
Yes.
Are you familiar with that?
No, absolutely.
So, Dr. Laposata, what did you mean when you described that Mr. O'Keefe's body was thrust backward from a standing position?
I mean that he was standing upright and his body had momentum and went down and hit at the back of his head. So it was thrust backwards.
You cannot tell forensically how much momentum he had, can you?
No, we don't do those analyses.
And you can't tell if anything caused that momentum based on the head injury, can you?
What do you mean causative? It was caused by his body went backwards.
Yes. And so the amount of force causing him to go backwards, that's not something you can determine from the head wound, is it?
No, I can't tell you the amount of force. It was significant because he had the massive skull fractures.
Did you say it would be significant?
Yes, significant force.
In modern medicine, there are a number of different machines that can help us see the brain, like a CAT scan, perhaps,
Sure.
MRIs.
Yes.
Would you agree with modern medicine that the use of MRIs and CAT scans and other tools give a clinician equal, if not better, opportunity to examine the brain as actually cutting it and holding it in your hand?
No, the actual gold standard is the pathology, to be able to have the brain in your hand, look at it with your naked eye. And we have conferences in the hospital where we meet with radiologists and say what we find at autopsy and see if their radiology was correct.
Can CAT scans and MRIs show contusions on the brain?
Well, they might.
Subdermal hemorrhages?
Subdural hemorrhages. Yes, they can.
Herniations?
They can.
Do you have any doubt about the modern medicine and the use of MRIs and CAT scans? Do you think they're inadequate in any way?
Well, I'm not a clinician, so I don't use those to diagnose diseases in living patients.
Dr. Laposata, have you ever had any experience studying the brain in real time, clinically, going and opening somebody's skull and treating the injury before the person dies?
No, I'm not a neurosurgeon.
You don't have any neurological expertise, do you?
I'm not a neurologist. I'm not a neurosurgeon. I'm a forensic pathologist.
Do you have any clinical experience at all where there's an acute head injury and you're making an effort to observe it and analyze the injury as it progresses in an attempt to save the person's life?
I don't treat or diagnose living patients.
I understand, but as far as your background, have you ever had any experience, clinical experience, showing the progress of an actual brain injury and trying to treat it?
I understand the physiology of what happens to the brain when it is impacted by something, whether it be a bullet, a boulder, a fall. So I know what happens to the body to cause the changes from that trauma. I don't treat people for those injuries.
In observing a brain that's in trauma and making determinations of how long it's viable or whether the person will expire, do you know the process that a neurosurgeon would go through in order to fight to preserve the person or save the person? Do you know the step-by-step process that they would undertake?
To do what?
To try to operate or save somebody from a head injury, from a brain injury.
I'm going to allow it because of prior testimony.
Well, it depends on what the brain injury is. If you have head injury and you have bleeding on the brain that's pushing the brain one way or the other, it would be a subdural. Then a neurosurgeon would come in and try to take that blood away so it doesn't compress the brain. So that's something that neurosurgeons do to treat head trauma. They can also put in drains into the ventricle of the brain, and that can relieve pressure in the brain because that brain swelling is a bad thing. So those are some of the things neurosurgeons do to treat brain injuries.
And can they remove part of the skull to relieve pressure?
Oh, yes, they can do that. It's called a craniotomy. They can take out part of the skull if they need to.
So there are a number of different steps that a neurosurgeon can take when someone suffers acute brain trauma to try to save the person, isn't there?
Well, the job of any doctor is to try to save a human life if you treat living patients. So certainly a neurosurgeon would evaluate the patient and decide if there's any treatment needed that could improve the patient.
When you've had cases in the past as a medical examiner where there have been issues regarding brain injury, wouldn't you agree that you have sought outside consultation with people who have a higher degree of specialty in brain injury than you?
Sometimes what we do is when we're examining the brain, we can call in for a conference and have a neuropathologist come in and review the brain with us.
And back when you were a medical examiner, you did that on a number of occasions, didn't you?
Yes, that's routine.
The reason why is because there are different specialties in medicine, and some are different and separate than your specialty, correct?
Of course.
And a neurosurgeon or a brain surgeon, it would be a different specialty than yours.
Yes.
And they're focused on the brain, yes?
A neurosurgeon does brain surgery.
And so, how many times in your career do you think that you've assisted the help of neurosurgeons to take a look at brain study to help you?
I've never needed to speak with a neurosurgeon to look at a brain. Sometimes we call in neuropathologists and we have a forensic neuropathology conference where we look at brains with the interns and residents.
How often would you call a neuropathologist?
Maybe once a month we would have a routine conference.
And again, the neuropathologist, that's dealing with a person's brain after they're already died.
Correct.
So it's not a clinical setting or a clinical experience of actually watching the brain at work and seeing the injury as it progresses.
We don't do neuropathology like that on living people. The person is deceased.
You had an opinion to the jury today, and you said that you believe that Mr. O'Keefe died within 15 minutes?
Yes, I think that process would start within 15 or 20 minutes.
Is that to a reasonable degree of medical certainty, that opinion?
Yes, based on the severity of the injury and the brain swelling.
You're aware that there are numerous level 1 trauma centers around the country that deal with brain injury, right?
Sure.
And the idea is that people suffer all types of brain injury, and if they are given medical attention in a reasonable amount of time, there's a chance they can be saved, yes?
It's possible, but many are so severe that they cause death no matter how fast they can get medical attention.
In fact, every day when people get the right attention or proper attention, they're brought to level 1 trauma centers around this country to try to help them or save them. Isn't that fair to say?
I would hope so.
Do you think?
Sure.
When you looked at Mr. O'Keefe's brain, obviously it's after he already expired, correct?
Obviously,
And
yes.
so you didn't have any clinical observation of the progress of his injury that night, did you?
I was not observing him. I did not observe how he got his injury.
When you gave an estimate or you give an opinion about how long he was alive for, are you aware that there's certain tests that are done by neurosurgeons when people are suffering brain injuries but there's an attempt to save them?
Sure.
Have you ever heard of a Guzman coma score?
Glasgow, you mean?
You know, with his Glasgow, but you've heard of Guzman?
It's called Glasgow coma score.
Have you ever seen the assessment that a level 1 trauma center goes through when they're trying to save somebody with a brain injury?
I'm generally familiar with the emergency procedures to save somebody's life.
Have you ever read any statistical studies attempting to correlate the brain injury with the time somebody would live for?
I'm aware of that, and I see that in my practice of people who have survived brain injuries and die of something else. Then I can look at the brain and understand how the brain can heal or react to injuries.
And many people who suffer coup contre coup will go into a brain surgeon center, and many of them pass after time, don't they?
Now, every case is different.
Right. Some might live for an hour, hours, weeks, months, or survive the injury. Isn't that fair to say?
It depends on the case.
In this case, you don't have any objective criteria to identify the amount of time Mr. O'Keefe would have lived if he had the appropriate help. Isn't that fair to say?
I don't think it would have been effective because there were massive skull fractures to the base of the skull, and there are cases where the amount of force and energy applied to the head, causing skull fractures, breaking the neurons, causing the brain swelling, despite rapid medical treatment, those people cannot be saved. They can't effectively stop the brain swelling.
Many people can't be saved. Did you know that about 1/3 of them do get saved?
I don't know what you're talking about. 1/3 of everybody has different sorts of injuries. 1/3 of what?
With a clivus fracture, coup contre coup. Are you aware that 1/3 of those patients survive if they get the proper treatment?
It depends on the amount of force.
Okay. Are you aware that a study would show, have you ever read a study by Isaac Wolf on clivus fractures?
No.
Have you read any studies on clivus fractures?
Clivus fractures? Yes, I understand what clivus fractures are. It's a part of the base of the skull.
Okay.
And
And
it
have
depen-
you-
Oops. Okay, go ahead.
Please. Did you want to
No,
say?
you go ahead.
Oh, I'm sorry. Have you read any studies that tell you with the proper treatment, despite these potentially catastrophic injuries, that 1/3 of patients can survive?
No, but that's not the case we have here.
And so in this case, I asked if you had any objective criteria. You don't have any objective criteria about the progress of Mr. O'Keefe's wound that can be a basis for you to conclude that he would have died in 15 minutes. Isn't that fair to say?
No, I understand what happens to the brain when it gets that sort of injury. I understand the time course and the physiology. I've seen hundreds of individuals who've had brain injuries. Some survive for a longer period, some die earlier, and it depends on the amount of force and the amount of brain swelling. And in Mr. O'Keefe's case, we had the massive skull fractures of the base of the brain and immediate swelling and subarachnoid and subdural. So he had a large force applied to his head, which caused the brain swelling and the and the progression of the brain stem down through the foramen magnum that stopped the brain. It was a very forceful impact.
You examined his brain after you looked at photographs. You can't tell us objectively when his brain swell started.
It started immediately after impact.
And you can tell us what the progress of that brain swell was by looking at his post-mortem photos.
By looking at the postmortem photos and the postmortem examination, I can tell the degree of force from the extensive skull fractures that were present.
What was the degree of force?
It was medium to large.
Well, that's a wide range. What do you mean? Quantify medium
So I'll
to
strike
large,
the comment,
please.
ask the question, Mr. Brennan.
What does medium to large mean?
Enough to cause a lot of fractures to the skull. He didn't just like sit down and lie down.
If he sat down and lied down, he probably wouldn't have fractured his skull, correct?
That's obvious, yes.
Right. And so when you're telling us you can identify that he immediately died or died within 15 minutes, I'm asking you for objective criteria. For you to give that opinion, I'm asking you what objective information you have. And so you said that there was a large amount of force, correct?
Sure, but because there were massive skull fractures, and there's a lot of energy transmitted to the brain, starts swelling immediately
How do you know this wasn't medium force and not large force?
because of the extensive number of skull fractures.
So are you saying it was medium or large force?
Medium to large.
Okay. How much force is that? Can you quantify it?
No.
What other objective criteria do you have to support your opinion that Mr. O'Keefe died within 15 minutes?
My training and experience of seeing thousands of deceased people from head injuries and knowing some of their clinical course when they get immediate medical treatment, they don't survive.
But you would agree many do.
Depends on the case.
And in this case, you didn't have any opportunity to observe the progress of Mr. O'Keefe's injury that night, correct?
I'm going to allow that.
I wasn't there.
You had-
The body told me what happened to it.
You have no assessment of the development of his brain injury and how much time it took that night, do you?
I do, from understanding the significant skull fractures and the swelling of the brain and the compression of the brainstem that all happened very rapidly because of the amount of force that caused all those skull fractures on the base of the skull that actually then hemorrhaged into his upper eyelids. That's a large amount of force.
Was gross edema found on his brain?
I think it was swollen, yes.
But was that a finding?
Yes.
Where did you see that finding?
Well, in order to have the herniation of the brainstem, the brain swells.
Where did you see that finding?
I can't answer that. I just know it from understanding, looking at the pathology.
So at the end result, at some point, Mr. O'Keefe had gross edema.
In order to get the brain stem hemorrhages, the only way you get that is because the brain has swelled, and there's no, after injury, tissue swells, and there's no place for the brain to go when it swells except down into the natural hole in the bottom of the skull where the spinal cord goes down. So that's where the pressure goes. So that seeing the brainstem herniation tells you that the brain has swollen a lot.
Undoubtedly, but it doesn't tell you when it began to swell or the progress of that swell, does it?
I don't know what you mean.
you see inevitably because of the swelling, there's the suffocation, but when you see that, you don't know when the swelling began or how quickly it progressed. You can't tell that from an autopsy.
Yes, you can, because of the severity of the skull fractures. I know there was a lot of force, and that force applied causes you to go unconscious, then your brain swells. If there was just like one skull fracture, then that's a little bit different. But this was massive skull fractures on the base of the skull. So there's a lot of force applied. So I know because there's a lot of force applied to cause the skull fractures, that the brain would swell rapidly.
You would be unable to identify the rapidity of the swelling if you don't know the amount of force. Isn't that fair to say?
Well, I do know the amount of force because of the amount of skull fractures.
In what you know is, in your words, medium to large force.
Yes.
You've heard of periorbital ecchymosis,
Yes.
and that's sometimes called raccoon eyes.
Well, periorbital ecchymosis just means bleeding and bruising around the eyes.
And you saw the bruising around Mr. O'Keefe's eyes, didn't you, in the photographs?
Well, it wasn't bruising caused by blunt force trauma to the eye. It was bleeding in the upper eyelid because the plates above the eye and the base of the skull were fractured by the brain hitting it. So, and that's a result of basilar skull fractures and not the application of force directly to the eye.
Would you agree it takes a few hours for the bleeding to accumulate in the person's eyes?
No, as soon as you break the skull bones and the heart's pumping, the blood comes out of those injuries.
So
It starts to accumulate right away. It starts within minutes, you can see it.
So you would disagree with the suggestion that it takes at least 1 to 2 hours for that bleeding to occur in the eyes. You disagree with that?
I do disagree with that. It starts immediately.
Do you have any studies that you've relied on or literature or support for that?
I understand the physiology of what happens when you get those skull fractures and the density of the blood vessels. And if your heart is pumping, you pump the blood out those broken blood vessels into this small area above the eye. And
Do you have
it can happen within minutes.
Do you have any studies or literature to support that?
That's my training experience. I can't cite you a particular article at this time. I could certainly go look it up and bring it to you.
Okay. Let me ask you questions about the wounds to the back of Mr. O'Keefe's head.
Yes,
You see a linear abrasion?
yes, vertical lines, yes.
Now, would you characterize this as a classic wound caused by falling backwards and landing on your head?
What do you mean every wound is different?
Every wound is different?
Sure, every person's different, every way you get injured is different.
And so if somebody falls backward on their head and suffers the basal fracture, the wound from your perspective can look different.
It depends on the impacting surface.
Wounds on the same surface, say two people fell on the same surface, could they have different wounds on the back of the head if they suffered the same injury?
In theory, if they fell, if they rotated their body, if you could reproduce something exactly, then you would see the same wound patterns.
This wound pattern is typical of falling backwards on a hard surface, isn't it?
We know it's from falling backwards and striking something hard.
Can the frozen ground be hard?
A frozen ground can be hard, but it doesn't fit the pattern in this injury.
We'll get to that, but is it
Oh, okay.
hard enough to cause a basal fracture?
It can cause a skull fracture.
The frozen ground is different than a sheet of ice, right? It's not smooth and flat like a sheet of ice, is it?
It could be, I guess.
Okay. You mentioned there's some granular patterns in this wound.
Yes.
didn't you?
Yes.
The area in front of 34 Fairview, the frozen ground, do you know if there was any impediments in the lawn that was frozen?
In the what? Oh, the lawn?
Yeah. Yes, sorry.
Yes, I saw the scene photographs of when the snow was removed, and it was like winter lawn grass, so it was some green, some brown that was pushed down, and like straw that was going different directions, which wouldn't give you that pattern.
Did you see the exact area where Mr. O'Keefe last moved?
I saw that general area, and there were a lot of photographs,
Well,
yes.
You say general area. Can you tell us that you saw photographs of the spot where Mr. O'Keefe was lying when he was found?
Yes, that general area.
Could you see the ground where his head was? Can you identify that?
Yes, with the scene investigation, they shoveled the snow off of that area.
And you had never had a chance to go out to that scene yourself, did you?
No, I just looked at all the photographs.
You cannot see what's under the grass and the dirt, can you?
Well, dirt's under the grass.
Well, do you know if there's any rocks or impediments or bumps?
It was a smooth surface covered with grass.
It was a smooth the front lawn was a
It
smooth
was a
surface?
flat surface
Flat.
covered with grass.
Okay, and do you know what was under the grass, whether there was any pebbles, rocks, debris?
I didn't see any.
From the photo.
Correct.
But you don't have any firsthand knowledge that exact area where he ended, what the turf was like, do you?
I saw photographs of that lawn where they removed his body from.
So you're relying solely on the photographs, is that fair to say?
Correct.
Do you know if Mr. O'Keefe was wearing anything that could cause abrasions when he landed to cause that scraping pattern in addition to the linear abrasion?
He did have a baseball hat on, but that would not cause the pattern.
The area of the abrasions, is that in the area of the level of where a baseball hat would be on the back of somebody's head?
It could be.
Could be. If somebody hits the ground and falls backwards, can they slide?
If they're on an incline,
What if they're thrust?
well, if you fall backwards and you fall backwards on an incline, your body might move.
Well, what if you fall backwards on flat ground? Does the body, can it move after it falls?
Not really, maybe a little. If from the momentum of the impact, it might move slightly, but not really.
So when a person falls backwards and lands, you don't think their head has any room for movement?
Not significant.
Well, not significantly, maybe just a quarter inch, half inch.
No, it's possible.
Okay. And did you see the scrapes around the wound of Mr. O'Keefe's head?
Of course I saw them, yes.
Okay. And they're all within, what, about an inch?
What are you describing? What part? Are you describing the tearing, the laceration of the scalp, or the vertical abrasions?
The vertical abrasions.
There were maybe an inch and a half.
Inch and a half? Do you think that if someone fell backwards and landed on the head, they could move an inch and a half?
Well, he landed on something that had a ridge on it to cause the laceration in the scalp, and then with a little bit of movement, those vertical scratches were caused by some kind of like pebbly-like surface.
You mentioned that the orbital bones were broken and you had opined that it was caused by the brain. Do you agree that a brain is very soft, consistent with, for example, tofu?
Oh, gross. What do you mean? It is soft.
Is it that soft? Is that the texture of it?
Well, it depends on what kind of tofu you have.
Okay. Do you think that the orbital could have broken when the break on the back of the head split the skull and then would cause the orbital break instead of the brain?
The orbital plate fractures, if you look at the base of the skull after you take the brain out, you can see the fractures go up from the back to the front into the orbital plate. Sometimes when you fall backwards, the brain can also slap those orbital plates and cause some damage, but I could trace the fractures from the point of impact along the base of the skull to the part of the skull over the eyes.
Do you think the base of the skull break, when it separates, could have caused those orbital fractures?
I don't understand your question.
Okay. When Mr. O'Keefe incurred that head injury,
Yes.
the basal fracture, do you think that the pressure, the damage from that basal fracture, the separation, could have caused the orbital breaks in his eyes?
Well, the fracture of the plates above the eye, when the blood is still pumping, there's a space there where the blood can come down into the upper eyelid.
So you described the brain as causing that break. I'm asking you, could it have been from the basal fracture, from the skull fracture?
Yes, the fracture that was caused by the impact to the back of the head, radiating to the front of the base of the skull.
So when you told us on direct it was from the brain that caused those fractures, was that just a summary, or is that to a reasonable degree of medical certainty?
Well, sometimes the brain can also, in a fall, flap and hit those, but in this case, I could also see that the skull fracture started at the back and came to the front, but it could also be contributed to by the brain hitting those delicate bones.
I guess my question is, when you've provided the opinions generally of what you believe and what you've seen, are these general opinions, or are they actually specific opinions based on the facts of this case?
They are opinions based on my examination of this case, but all that's based on my 40 years of training and experience.
Well, when you told us about the brain causing those orbital fractures, you would agree with me, at least now anyways, that it very likely could have been the basal fracture that caused those breaks.
Yeah, both.
It could have been both?
Sure,
Okay, could it have been just the basal fracture?
that's possible.
When you offered the opinion to a reasonable degree of medical certainty, had you considered the basal fracture as the source of those breaks?
Of course.
Is there a reason you didn't share that with us and you just said it was the brain?
I had no reason not to share it.
Okay. Was there any depressed fracture to Mr. O'Keefe's skull?
No.
Can you tell us a little bit about a depressed fracture? Depressed fracture is different than what we saw with Mr. O'Keefe, isn't it?
A depressed fracture is when something fractures the skull and then pushes the skull and moves the skull inward. This just had a fracture, but it didn't move the skull inward.
And you've seen depressed fractures in your practice over 40 years, did you say?
Of course.
In those 40 years, depressed fractures can happen from sharp objects,
Sure.
pointed objects.
Sure.
If someone hit a person in the back of the head with enough force, with like a hammer, for example, that could leave a depressed skull fracture, couldn't it?
Certainly. You can hit somebody on the head with a hammer and cause the fracture, and then the continued force will move that fracture into the brain.
There was no depressed skull fracture in this case, was there?
Correct.
You gave some opinions today about you gave some opinions about wounds on Mr. O'Keefe's arm. I'd like to talk to you a little bit about that.
Sure.
Could we have that photo brought up, please? Do you see all of those superficial abrasions?
Yes, I see patterned injuries.
Right. Would you agree that they're superficial abrasions?
Yes, they go along the skin surface.
How many punctures would you identify in that photograph?
Let's see, there may be some punctures like around the elbow, consistent with the teeth puncturing. Most of them are the teeth scraping along the skin.
Well, I'm not going to ask you what you believe the cause was. I'm going to ask you just about the wound. How many punctures do you see?
Well, this doesn't show. There are other photographs which show more of them, but there's the little dot-like areas. You could call an area of skin puncture.
Can you tell us from this photograph how many punctures you would say are in that photo?
I didn't count them.
Well, did you suggest that there was more than one puncture on that wound?
I think I see more than one, yes.
Pardon me?
I see more than one on there.
Okay, could you give us a count of how many punctures you see?
Well, without looking at all the photos, I couldn't give you a correct number.
Okay. You've written a report, haven't you?
I what?
You wrote a report,
I did.
and in your report, you describe many of those abrasions as punctures, don't you?
Yes.
And a puncture isn't just a scratch. A puncture is a penetration of the skin, isn't it?
Yeah, a point-like penetration.
A puncture has a very specific medical meaning, doesn't it?
Yes, it's a point-like penetration of the skin.
And according to you, there are many punctures in that wound.
Yes, I can see 1, 2, 3, 4, 6 or 7.
Can medical professionals disagree on opinions about wounds and causes?
I suppose they can.
You also gave some opinions that you did not believe that Mr. O'Keefe's scratches were caused by having some impact with broken pieces of plastic or glass, correct?
Correct. They weren't caused by that.
Broken plastic or glass can cause a number of different angled wounds, can it?
It causes an array of irregular, random injuries.
It can have infinite different patterns, couldn't it?
Could.
There's nothing to hold a wound from a broken shard to be north or south or east and west. It all depends on how the force is impacted on the body, true?
I'm not quite clear on your
Okay,
question.
I'll try to do better. When you're talking about shards of broken glass or broken plastic, there is no set direction that they may cut somebody, is there?
Well, it would depend on the case and how those occurred.
Right. They can happen in many different forms as far as depth, yes?
Well, anything's possible.
Right. How about length?
What about length?
Wouldn't that change? Couldn't that change depending on how the injury occurred, the length of the wound?
Sure.
And in this case, you talked about your opinions of injury relative to a motor vehicle, didn't you?
That was something I considered.
That's something you considered. Did you know much about the details of the motor vehicle in this case?
Yes.
Okay. When you considered your differential diagnosis, did you consider whether there was any DNA on the vehicle?
I didn't look at any of that.
I'm sorry?
I did not look at any DNA.
Did you know if there was any hair on the vehicle?
I don't know.
Did you consider the scene itself where there may have been a debris field? Did you take a look at the debris field in this case?
I know there were photographs of various pieces of plastic around the area where the body was found.
And do you remember where those pieces were found?
Somewhat, yes.
Did you have an opportunity to consider other evidence like a shoe in the area near where Mr. O'Keefe was found?
I know one shoe was on his foot at the hospital, the other was at the scene.
Do you know if his hat stayed with him after he landed on the ground?
The hat was in the area where his body was found.
Did you take a look at his pants, the back of his pants?
I looked at that, yes.
Okay, what did you see when you saw the back of his pants?
Well, because he had bled from the back of his injury and he was on a hospital gurney, some of that blood came down, so some of the blood was on the back of his pants.
Did you see anything else other than blood on the back of his pants?
I don't remember.
I'm sorry?
I don't remember if I saw anything else.
Did you look, when you were doing your differential diagnosis, did you look at any evidence other than physical evidence? Did you look at any data evidence?
I don't know what you mean, data.
Like data you would find on a cell phone?
No,
Did you look at any of the data evidence from the defendant's Lexus?
no, other than looking at the contours of the back to see if it had impacted Mr. O'Keefe.
When you were doing differential diagnosis, did you look at any information that would tell you what the speed of that impact may have been or allegedly was?
Well, it didn't hit him, so it doesn't matter.
Okay. So you didn't care to know anything about the car or the data in the car because you had already formed your opinion?
It did not hit him, so it was not relevant to my opinion.
Is that a different way?
By looking at the body, I could tell that there was no evidence of impact with a vehicle.
Is that
So whether the vehicle was going slow or fast is not relevant.
And so you didn't try to get any information about the speed of the vehicle? It was totally irrelevant to you?
Correct.
And did you also disregard, well, let me ask you, do you ever look at statements?
I look at witness statements if they're available to me.
Were any of the defendants' statements made available to you?
I did hear some of them.
Did you consider the ones that you heard?
Of course.
Which ones did you hear?
I really can't answer that. I don't know what you'd have to give me an example.
You said that when Mr. O'Keefe first incurred his injury, you think that he was unconscious?
Yes, I think that the severity of the impact made him immediately unconscious.
So if hypothetically Mr. O'Keefe incurred his injury sometime around 12:32, is it your opinion that he never moved again until he was moved physically by somebody else?
Well, I don't know the exact time that he got the injury on the back of the head, but after that time, he could not carry out any purposeful activity.
May I approach Sidebar, Your Honor?
Okay.
Good afternoon, Dr. Laposata.
Good afternoon.
Am I on point now?
You are.
You were asked on direct examination about your qualifications. You were a medical examiner for the state of Rhode Island, is that fair to say?
Yes, I was the chief medical examiner.
For 20 years?
12 years.
I'm sorry, 12 years. When's the last time you worked as a medical examiner?
In 2005.
When's the last time that you conducted an autopsy?
I've done probably a handful of autopsies, private autopsies in my consulting practice.
Since 2005?
Correct.
When do you think the last time you did one is?
Maybe 4 years ago, four or 5 years ago.
4 or 5 years ago?
Yes.
Okay. Since you left the medical examiner's office, have you had any specialized training in brain injuries?
It's all part of keeping up with the medical literature and knowing the forensic pathology literature, reading medical literature. So it's a continuing endeavor to keep yourself educated with medical updates.
Since you left the medical examiner's office, have you had any specialized training in brain injuries?
I've not gone to a course on brain injuries.
Since you left the medical examiner's office, have you taught any students on brain injuries?
Yes.
Have you given any classes or seminars on brain injuries?
Yes, I have.
In coup counter coup, how many times have you experienced that as a medical examiner, that condition?
Well, I myself haven't experienced it, which was good, but in cases, hundreds of cases, it's a common injury.
You said you did differential diagnosis. That is to exhaust any potential bias you have, correct?
Well, a differential diagnosis is to think, how many ways can you get this finding? And it does help prevent bias
Did you say on direct examination, part of the benefit of differential diagnosis is to make sure that you don't have a bias?
Yes, yes.
In order to eliminate bias, you're supposed to look at all reasonable alternatives, correct?
Yes, that's part of it, making a differential diagnosis.
So you don't just look at a person's body, come to a conclusion, and ignore other evidence. That would kind of defeat the purpose of differential diagnosis, wouldn't it?
Well, you always have to look at all the evidence.
And so if you didn't look at all the evidence and you disregarded some of the evidence because you had already made up your mind, that really wouldn't be the proper study of differential diagnosis, would it?
Right, I don't do that.
I'm sorry, ma'am.
I don't do that. I always look at all the evidence.
And would you look at all the evidence even if it was contrary to whatever opinion you want to give in court?
Well, the evidence allows me to come to an opinion. So it's not like I decide on some opinion I want to give and then look for the evidence. The evidence is going to tell me what happened to the body.
So you would never say, like, I don't need to look at that evidence. If it's presented to you, you would look at it and study it and consider it in differential diagnosis?
Sure, it may or may not apply, but I'd look at it.
Because if you did that and said, well, I don't need to look at this, and it was relevant evidence, that would defeat the whole idea of differential diagnosis, correct?
Well, you always want to look at all the evidence that's going to help you decide what happened to the body.
If you were to ignore relevant evidence because you already made your mind up, that could create some type of bias, even if you're not recognizing it, correct?
Well, I don't make my mind up. I make it up on all the evidence I have. Then if something else other evidence comes up later, I have to reevaluate everything and consider that new evidence.
When you were talking about car collisions, I don't want to belabor the point, but you didn't major in physics, did you?
In what?
You didn't major in physics, did you?
No, I took physics, but no, didn't major in it.
Okay. And the last time you took physics was probably, what, undergrad?
Correct. Thank goodness.
You have no study in biomechanical engineering?
No, I'm not a biomechanical engineer.
Understood. You never taught courses in accident reconstruction, have you?
Only in terms of looking at the injuries on the body and showing how that they could or could not have occurred from impact with a motor vehicle.
Have you taught classes in accident reconstruction?
Only as far as it would affect the findings on the body.
Do you know what I mean by when I say accident reconstruction?
Well, accident reconstruction meaning, and I'm telling you that my expertise in accident reconstruction is restricted to looking at the body and then understanding how impacts may or may not have occurred to the body. I don't take a car and look at mileage and such like that.
You don't do any studies of the actual vehicles, you're focused on the body?
I'm focused on the body, but I also look at the vehicles to look at the points of impact that might be possible.
You do not have any advanced study in biomechanics, do you?
No.
Okay. Now, you had mentioned that when you were in the medical examiner's office, you had a number of higher profile cases.
Well, every case is important because somebody's dead.
You pointed out some pretty specific ones on direct examination. Were those more important, the ones that were highlighted, or is that the same as every other case?
I don't know what you're talking about.
Well, you had mentioned the Egypt airline crash, station nightclub fire. Those were highlighted or pronounced on direct examination. Are they equally important as every other case?
Oh, absolutely. Every person is my patient.
You talked about some of your commendations. The station nightclub fire, you received quite a bit of criticism on that, didn't you?
Well, there was a flurry of negative press without any basis.
You had mentioned that a doctor, a medical examiner, should have gone out to the scene to look at the area where John O'Keefe was found to make observations. Did you suggest that in any way on direct examination?
You have to know what the scene looks like, and usually that is documented in police reports and in police photographs who document the scene.
The station nightclub fire, that had numerous victims, didn't it?
Yes, 100.
And you received criticism because you were repeatedly requested by emergency responders and police officials to come to the scene? and you refused?
That's incorrect. First of
Okay.
all, nobody called me to come to the scene, and medical examiners are not first responders. As soon as I got a call that there was that fire in the nightclub, my investigator went right to the scene, and I was in constant communication with him throughout the early morning hours of that horrible accident. And I went into the medical examiner's office because I had to start getting ready to run our office 24 hours a day to not only take care of the poor individuals who expired in the nightclub fire, but also the regular work of the medical examiners. So there was no need for me to go to the scene because I had my investigator there, and my job would be at the office to get things all set up to handle the influx of deceased.
Did you receive criticism that over 17 hours there was an effort to have you come to the scene, but you refused?
There were,
I'm going to allow it in a different form.
yeah, that's incorrect.
Hold on, Dr.
Oh, I'm sorry.
Oh, no, I didn't mean to scare you. Just
Oh, okay.
hold on for a second.
Okay.
Ask it differently, Mr. Brennan, please.
Did you receive criticism that officials?
I'm going to allow it based on the ending, pursuant to the ending. Let's get it.
Did you receive criticism that for over 17 hours officials were asking you to come to the scene and you refused?
It was untrue. It was printed in the newspaper. We looked up all the phone records and provided it to the newspapers and showed that nobody called me to go. I would have gone if I needed to. I had my investigator there. It was just bullshit. No, it was erroneous stuff.
Was there other criticisms in 2005 before you left the office?
No, there was a flurry of stuff in the papers. There were union issues, new director of health, new governor. So yeah, there was a little flurry of stuff, which was not substantive.
So you inevitably did resign in 2005.
Yes, because my budget was going to be cut, and I knew that if I had to get rid of a medical examiner, we couldn't do a good job for the state, and I'd done it. I'd been chief for 12 years. I'd been on call 24 hours a day for 12 years, which was an honor, really. But then if I couldn't do a good job, if we cut the budget, I had to get rid of a medical examiner. I couldn't serve the people of Rhode Island well, so I resigned.
Did you resign shortly after the audits and criticism?
No.
Same year?
Oh, I don't even remember.
Okay. After you resigned, you opened your own company?
Yes, I started an independent consulting practice.
How much of your business is consulting?
It's a consulting practice.
Yep. How much of your business, how much of your income is consulting?
100%. It's consulting.
Do you consult in both criminal and civil cases?
Yes, I do.
What percentage of cases are criminal cases?
It's maybe half and half.
Half criminal, half civil?
I don't keep track of it in that way, but that would be a guess.
I'm sorry, I didn't hear you.
I don't keep track of numbers of civil or criminal cases that I'm consulted in. If I had to give an estimate, it would be half and half. I've worked on over 1,000 cases in my private company.
And fair to say you get compensated for your time.
Yes, I get paid for my time.
Dr. Laposata, you had mentioned that there were some scratches that you had taken a look at on Mr. O'Keefe's body. If we could have Exhibit 165, please. Now, would it be fair to say, Dr. Laposata, you do not know the genesis of that cut on Mr. O'Keefe's right eye?
I do not know what caused it. I can tell you what didn't cause it, but I don't know what did cause it.
You said that was from blunt force?
It's from application of blunt force to that little area that broke the skin.
When you were asked a question about whether that was consistent with a punch, you opined that it was consistent with a punch, yes?
It could be consistent with a punch.
You weren't saying it was consistent with a punch to a reasonable degree of medical certainty, were you?
That would be within my differential diagnosis.
It could be consistent with all other types of blunt impact, or many other types of blunt impact, couldn't it?
That's correct.
Ground, perhaps?
No.
No, an object?
If it was a an object that could get into that area under the eyebrow, yes.
You mentioned the spoiler on the back of Miss Reed's Lexus. Do you remember that?
I remember that.
Do you know how tall John O'Keefe was?
He's around 7 foot, 5'11", I think, 7'2", something around in there.
No, he's more closer to 6'1". Does that make sense?
Sure.
Okay. And that spoiler on the Lexus, do you know how high off the ground that is?
No.
Did you ever try to measure it or ask for photos or any information about that?
No, I looked at the photos.
Did you ever ask for any measurements or try to take any measurements?
No.
Could I have Exhibit 166, please? Did you see this cut on Mr. O'Keefe's nose?
That's a scratch. It's not made by a sharp instrument. It's not a cut. It's a scratch.
Is there any scratches on the left side? Do we have a photo of the left side? Please. And that, you say that's a scratch, not a cut?
Correct, because a cut means it's made by a sharp thing, like a knife, and a scratch is made by something that's kind of rounded that has a little point on it, but it's not sharp.
Okay. Do you have any information or basis to say where that scratch came from?
No.
Did you do any differential diagnosis on that scratch?
I don't know what caused that. There could be a number of things that caused it.
There was no scratch on the right side of Mr. O'Keefe's nose?
I don't see it one, no.
Could you zoom in, Ms. Gilman? So the only scratch was on the left side?
Looks to be, that's not a good photograph because there's some blood obscuring the skin.
Yes.
If my memory serves me, there is a scratch on the left side of the nose and maybe a small scrape on the tip of the nose.
And we can go back to the left side? And you said that could not have been caused by a sharp object?
Correct. It's not an incised wound. Incised wound means a bladed, sharp cut. This is a scratch, not made by a blade.
Were you aware the defendant made a statement that she pulled a piece of glass from the defendant's nose?
No.
And you would say that that wound is inconsistent with being caused by glass or a sharp object?
It would not be caused by a blade. It could be caused by a piece of glass that was thick.
I thought before I offered you that statement, you had said that it could not have been caused by glass. Do you now have a different opinion?
I don't remember saying it couldn't have been caused by glass.
Didn't you say it couldn't have been caused by glass or a sharp object?
A sharp object.
Like
a sharp object, like it's not an incised wound made by a blade. It could be caused by something sharper that's thicker, but does not have a thin blade. So it could be caused by a thicker piece of glass.
If somebody is deceased, does any blood pressure from their heart still move in their body?
No, they're dead.
If somebody removed a sharp object like glass from somebody's face, would they spurt blood if they've died?
If you're dead, there's no blood pressure. So if you're dead and you remove something, there may be some superficial blood, but it's not going to have blood flow because your heart's not pumping blood out of the cut ends of the blood vessels.
So it's not going to spurt if you pull something out of a person's skin if they've passed?
You wouldn't get a spurt of blood from arterial pressure.
I just want to ask you a very few questions about hypothermia.
Sure.
You mentioned that Mr. O'Keefe's body temperature at the hospital was 80 degrees.
Yes.
And there's different ways to take somebody's or a body's temperature, isn't there?
Yeah, that was a rectal temperature, so that's a good representation of the body temperature.
Is the variance between a common practice of taking temperature and by somebody's mouth and rectal, is it about a 3 or 4 degrees difference, or do you have a different experience?
It can be different. A rectal temperature gives you a better internal body temperature. The oral temperature, if you're breathing in or if you just had something cold in your mouth, may not register a proper temperature. So the rectal temperature is the preferred temperature for a medical diagnosis.
98.6 is an important temperature, isn't it?
Yeah, it's our usual normal body temperature.
And so, is there a standard? Is 95 degrees considered hypothermic?
If you have, then clinically you would start to worry that the person might be experiencing bad effects of hypothermia.
At 95 degrees?
At 95, you start to worry about it.
And could some of the things that happen is labored breathing?
Is what?
Labored breathing?
What about labored breathing?
Well, if someone is hypothermic, if they're 95 degrees, does it affect their breathing patterns?
Not especially.
Okay. Does it affect the way their respiratory system works?
No.
Does it have any effects on the human body if you're hypothermic at 95 degrees?
No. You're still okay.
If that temperature continues to decline, it starts to become dangerous, doesn't it?
It can.
Mr. O'Keefe was evaluated, and at the hospital, his body temperature from a rectal reading was 80 degrees at about, what, 6:37?
Correct.
Did you know that before he got to the hospital, first responders had him in an ambulance?
Of course.
Did you know they turned the heat up and put blankets on him and tried to provide warmth to him before he got to the hospital?
Yes, that would be standard practice.
And that standard practice would usually add temperature to the person, wouldn't it?
Well, it might.
Okay. So it's possible it could, but it might not.
It usually doesn't add that much.
I see. And so inevitably, at 6:37, Mr. O'Keefe's body was 80 degrees.
Yes, when he got to the hospital, his rectal temperature was 80 degrees.
And so that is a drop from the standard, or what's expected, of 98.6 degrees. That's a drop of at least 18.6 degrees.
Yes.
You mentioned that Mr. O'Keefe, after suffering his head injury, would not have moved other than twitching.
Correct. No purposeful movement.
Were you aware that he had an iPhone with healthcare data on it?
No.
If there's no movement, assume for a second there's no movement of Mr. O'Keefe after 12/32/16, and he's found a little after 6 a.m. in the morning. That's about 5 hours, or 5.5 hours, correct?
About.
And if somebody is in the cold for 5.5 hours, that's consistent with dropping from 98.6 degrees to 80 degrees in body temperature, isn't it?
If the person is dead, yes.
If a person is outside in the cold and still alive, will their body temperature decrease?
If they can, people can die of hypothermia, but that's not the case here.
Well, not the ultimate death, but if somebody's outside and they're alive and they're lying in the snow and it's below freezing, will they lose body temperature?
They will, especially if they're not bundled up well.
And body temperature can drop from 2.5 to 4 degrees an hour?
In a dead body.
Okay. In a living person, it can drop 1.5 degrees.
No. A dead body at room temperature will usually lose body temperature at like 1.5 degrees an hour. If a dead body is in a cold environment covered with snow and avalanche environments, the dead body can cool at 4 degrees per hour.
And so a person who is in cold conditions, starting to be covered by snow, less than freezing, they can lose body temperature when they're living, can't they?
If you're sure, you can. People die of hypothermia, but that's not the case here.
Well, someone could be alive, lose body temperature, and not die. That can happen, can't it?
Yeah.
Right. So if someone is in the cold, let's assume they're not dead for a second.
All
They're in the
right.
snow, below freezing, not moving. Can that person lose body temperature if they're still alive?
Sure. They just lie there. They can become hypothermic and die.
Even before they become hypothermic, can they lose body temperature?
Well, losing body temperature makes you hypothermic. Thermic is temperature and hypo means below. So your temperature goes down and you're hypothermic because it's going down.
And people can survive from being hypothermic if they get the right care.
Sure.
And so in that 5.5 hours, it is consistent with a person being outside in the cold and starting at 98.6 and ending at 80. That's consistent with being in the cold for 5.5 hours, isn't it?
For a dead body, yes. That's how a dead body would cool in a snow-covered cold environment.
And it could also be consistent with somebody who is alive for some time and then dies, correct?
I don't understand your question.
Somebody could be out in the cold, under the snow, sub-freezing. They could be alive for some time. Their body temperature could drop. And then when they pass and die, their body temperature could continue to drop probably at a more rapid pace. That still fits within
No.
5.5 hours, doesn't it, Dr. Laposata?
No.
Because if someone can drop 4 degrees of body temperature in an hour,
A dead body.
yes, it would only take about a little over 4 hours if it was at 4 degrees to go from 98.6 to 80. Yes?
Correct, yes. So he was exposed to that cold environment for 4 to 5 hours.
If somebody was alive for a couple of hours, it's a lower rate, say they lose 3 degrees, and then after that couple hours, they lose body temperature at 4 degrees, that would still fit and be consistent with a drop from 98.6 to 30 degrees,
No.
to 80 degrees, wouldn't it?
No, you were saying a dead body cools in a cold environment at maybe 3 to 4 degrees an hour. And that has nothing to do with a living body and how long they can stay at a body temperature.
Do you disagree that somebody could be alive, lose body temperature, out in the cold, freezing temperature below 32, they could lose body temperature at a certain rate, then die, and then continue to lose body temperature? Is that possible?
Anything's possible. It's just what's important is what happened in this case.
I'm asking for your medical opinion, though, rather than to be an advocate. As far as your medical opinion,
So sustained, and I'll strike that.
as far as
Dr.
your,
Laposata,
Yes.
could you listen to the question, please?
Of course, thank you, Your Honor.
as far as your medical experience, could somebody be alive, outside, in the cold, below 32 degrees, not moving, covered by snow, still alive, and lose body temperature?
Sure,
And then could they, after an hour, 2 hours, could they then die and continue to lose more body temperature?
sure.
You mentioned your opinion about injury on Mr. O'Keefe. And at one point you said that his injury was inconsistent with a taillight, and you said because there was no damage from the bumper. Do you remember saying that?
I don't think I said it quite that way.
Okay. Do you remember how you said it?
No,
Do you remember discussing or raising the issue of a bumper as part of your equation, that the injury to Mr. O'Keefe was inconsistent with the injuries?
he has no injuries on him that are consistent with being hit by the back of the SUV. That includes the spoiler, that includes the bumper.
Okay, if we could play video E, please. I want to ask you, Dr. Laposata, have you seen this video before?
No.
Thank you. You can take that down. Did you see anything in that video that would suggest any contact between that mannequin and the vehicle's bumper?
Objection.
I'm going to see you at sidebar on this for just a minute, please. All right, so jurors, I am going to strike the last bit of questioning of this witness and the video as it goes to this witness. All right.
Dr. Laposata, after you received materials, did you ever ask for any additional materials?
Let's see, I always make sure I have all the scene investigation, autopsy, medical records, police and witness investigate and witness statements. So I felt I had a pretty complete database. I didn't get the x-rays until a couple weeks ago, so that was delayed.
That was newer?
Yes.
You said a medical examiner has to make a determination in 90 days. Is that the rule?
When you work in a medical examiner's office, when you get a deceased in, our national standards want us to have the autopsy report completed and all the associated tests done within 90 days.
Can investigations occur and the additional accumulation of evidence happen after that 90 days?
Oh, sure.
Okay. Thank you, Dr. Laposata.
Yes.
Dr.
Okay,
Laposata,
hold on one second. Jurors, when I strike something, that means disregard it. And what I've struck through this witness, the video that you just saw and some of the testimony means that if it's in evidence, it's in evidence, but it is not part of your consideration with this witness. Okay. All right, go ahead, Mr. Jackson.
may I proceed? Thank you. Dr. Laposata, you were just asked a series of questions about body cooling, correct?
Yes.
Does a body, as it's cooling, does it know if it's indoors or outdoors?
No.
If there's a very cold environment, be it indoor or outdoor environment, would it still cool?
Oh, absolutely.
And it would cool would it cool at the rates that you earlier described?
Yes,
Even if indoors, if that indoors was cold?
absolutely.
Your Honor, may we approach along with the Commonwealth very briefly? May I, Your Honor?
Yes.
Thank you. Dr. Laposata, stand back here for a quick second. Before I sat down the last time, I asked you a little bit about x-rays
Yes.
and the effect of x-rays on an evaluation by a forensic pathologist. Do you remember that?
Yes.
Are x-rays important for a forensic pathologist to consider?
Yes, they are.
Did you find any? You reviewed the x-rays, correct?
Absolutely.
I'm going to relegate my question to just the right arm of John O'Keefe.
Yes.
Did you find any deformities, defects, breaks, fractures, or hairline fractures of that kind on any of the x-rays that you reviewed?
None.
May I approach you?
Yes, I have a question for you. When you printed these, did you print them from a flash drive?
May I have one look?
Sure.
I have some assistance with this.
Do you have them up on the,
We do have electronic versions of this.
why don't we do that instead of the big, the large?
As long as I can mark the large ones, I want those marked and moved into evidence for reasons that we discussed at sidebar.
So those will be, you're objecting to this, Mr. Brennan? Okay, well, even if the Commonwealth objected, I'll allow those in, but I prefer to give the jury a flash drive with these on them instead of these big. So we will mark your flash drive, And you can just go ahead, in evidence, we'll mark the flash drive. The flash drive will go in with the jury rather than these very cumbersome additional pieces of paper. And you can go ahead and show them.
If I did, I don't want to have a whole discussion in open court. If it
All right, jurors, we're going to make this one really quick. Yes.
Thank you so much. Sorry. I'm going to show these to you, and then I'll put them on an overhead. May I approach, Your Honor?
Yes.
Do you recognize this document?
Yes, I do.
How do you recognize it?
I recognize it by the medical examiner identification of Mr. O'Keefe, and I recognize the x-ray of the right hand, the right wrist, the right femur, and I can also tell by the R designation here that that's the right side of the body.
Is this what you reviewed in coming to your opinions and conclusions concerning injuries to his right hand?
Yes.
Thank you.
So these now will mark whatever the next exhibit in A, B, and C.
A, B, and C, yes, Your Honor.
The HHH is now 229A.
May I approach, Your Honor?
Yes.
I'm sorry, I need to wait. May I approach?
Yes.
Dr. Hewitt, sister,
Sure.
do you recognize this document?
Yes, this is a x-ray of the body of Mr. O'Keefe from the medical examiner's office. The R indicates the right side, and we see here the two bones of the arm. There's no injury to them. We see the pelvis bone. There's no injury to that bone. They're perfectly normal, and there's no abnormal soft tissue swelling. It's a normal right arm.
Thank you. I may have this marked as next to order B.
That may obviate the need to put it up, right?
It could.
The 229B.
May I?
Yes.
Thank you. Doctor, do you recognize this document?
Yes, this is another x-ray at the medical examiner's office of Mr. O'Keefe. And again, it shows the right side. We see some of the ribs there. We see the shoulder and the humerus, the upper arm bone. And the upper arm bone is totally normal. There's no soft tissue swelling around it. There's no breakage or microfractures.
Thank you, Doctor. With the court's permission, next in order, sub C is in Charlie.
Yes.
C.
Dr. Laposata, that's all I have for you. Thank you for coming.
Anything, Mr. Brennan?
No, thank you.
All right, Dr. Laposata, you are all set.
Thank you, Your Honor.
You can find our artwork and our designs at dropmicrodots.com.